Hello, my name is Desiree Leapart, and I am a graduate student at George Mason University, enrolled in HAP 671 Healthcare Databases taught by Dr. Alemi. I'll be going over entity relationship diagrams as these are important in designing and creating a relational database. Let's say you are a new health informatics professional working at a healthcare facility. You are tasked with creating a relational database to track patient care in the form of treatments, outcomes of those treatments, and critical indicators of a patient's current state. How would you go about completing this task? First, let's talk about specifying requirements, as you cannot create a relational database without understanding what is required. In order to specify the design requirements, you must understand the purpose of the database. You must also understand the actors, which are the humans or systems who will interact with the database, as well as the specific data that will be collected and maintained in the database. It's important to note that different actors may express different purposes. We must also analyze what exists, so this means understanding the current condition of the existing database, as well as asking organizational leaders about their current use of the data. It's important to understand the current structure of the database. We must also identify future decisions. So this means anticipating various roles of the data by discussing successes and failures with organizational leaders. By focusing on future decisions, we're able to anticipate the various roles that the information system might play. We can't always rely on organizational leaders to describe what should be included in the design. So we must also be able to push for change in business processes. Additionally, we must also add external experts to the conversation. These external experts may also be able to point to organizational needs for the database. It's important to also develop use cases. These use cases are used to understand how information exchanges between various actors and the system. So for example, one actor may use the database system for scheduling and visit summaries, while another may use the database system for visit summary. Now that we understand our requirements for the relational database, let's start constructing our entity relationship diagram. What is an entity relationship diagram? It's a visual representation of entities and how they relate to one another. You may also hear it described as a database model. One component of the entity relationship diagram is an entity. An entity is anything that we want to maintain data on. Examples include providers, patients, or hospitals. We must also understand the attributes. So that's another component of the entity relationship diagram. Attributes are properties or traits of the entity. In this example, there are various fields identified, and these are the attributes: ID, ICD-9, age at diagnosis, and age at death. Key attributes are specific values in the data. Now we'll discuss primary and foreign key. The primary key is the unique identifier in the data. So for example, this can be a patient's social security number. A foreign key is used to identify records in other tables as they relate to each other. A foreign key in one table always corresponds to a primary key in another table. In the example here, in the provider table, the provider ID is the primary key. This corresponds to the provider ID in the patient table, which in the patient table, the provider ID is the foreign key. Another component to understand with entity relationship diagrams is the various types of relationships. We'll discuss the one-to-one relationship, one-to-many, as well as many-to-many. The one-to-one relationship is rarely used and are only used in specific situations, such as privacy and security reasons, or when we need to break very large tables into smaller tables. This example shows a one-to-one relationship with one patient and that patient's satisfaction rating. A one-to-many relationship is the most important and most frequent type of relationship in relational databases, and they're used to represent all types of relationships. So for example, one patient, as identified here, can have many different addresses. In the table, you'll see that the patient ID in the patient table is the primary key, while it is the foreign key in the address table. The last relationship we'll discuss is the many-to-many relationship. And in this case, the entities have many relationships to each other. So for example, patients can have many physicians and physicians can have many patients. It's not possible to indicate the many-to-many relationship with just foreign keys in either table, and therefore you have to have another table which represents the relationship. So here you can see that there is a patient table and that there is a provider table, but in between we have our encounter table, which serves as the relationship table that identifies the relationship between the provider and the patient. Thank you for watching my presentation. Please let me know if you have any questions.